Happy to welcome from AARP, Michigan, Associate State Director of Advocacy, Melissa Seifert. Hi, Melissa.
Hi.
Good to see you. Welcome back.
Thank you so much. Nice to be back.
Yeah, well, we haven't had a chance to have you here since before the pandemic, and that has been really a big focus of AARP's work over these last 2 years, helping people through the various issues of the pandemic.
Yeah. You know, everybody kind of took a piece of the pandemic, right? What was going on with society and what was going on with healthcare, and we really found our niche with helping individuals outside of nursing homes, but also inside, on how to go through this and how to navigate it. You know, we saw so early on so many individuals get COVID, not only residents, but staff as well. And so we needed to do something very early on, and we did.
A lot of people were surprised that nursing homes were not providing data to the state when they were creating all their dashboards and all the various information that we were using throughout this pandemic.
Yeah. I mean, all that's very true. I think they were in the thick of it. And so reporting, knowing what to report, it was kind of almost everything was behind a little bit on how we had to get it. And even, you know, PPE wasn't prioritized for nursing homes right away. So that's why we saw such an influx in individual receiving COVID, getting COVID, and then adversely passing away from it as well.
And I think, you know, when we talk about nursing homes, it should be emphasized that the nursing homes, for the most part, they were as responsible as they possibly could be. They followed the rules, the laws, but the way the government and the structures of dealing with the pandemic were set up, they were really at a disadvantage from the very beginning. Yeah,
and you know, like we just said, hospitals, physicians were prioritized with PPE. So when you don't have those proper protocols in place because you've never been through this before, it's kind of hard to catch up when it's already ahead of you. But you know, that's why AARP came out, like I said, really early on and really required and demanded that the government start providing PPE to these nursing homes, start having protocols in place for testing and making sure that individuals who have loved ones inside those nursing homes know what's going on. You know, you could visit your mom, your dad, your aunt and uncle before and have eyes and ears on staff and what's going on, but when they closed those doors to protect those residents, all of that went away.
Yeah, and I think the frustration for family members was that we don't know what's in the window visits. That was the only way in.
Absolutely, and you know, that's the other thing too, is that not all nursing homes are made the same. So when you picture a nursing home, you picture your experience, but there are some that don't have window accessibility. There are some that aren't able to social distance. There are people who are 4 to a room in nursing homes at some point. And so that's why AARP is really calling for changes. You know, I think the pandemic showed us it doesn't always have to be the way it's always been. And so to really be innovative on how we're looking at long-term care, how we're looking at nursing homes, and change that for the better for the residents.
You've got a dashboard. You created a dashboard from all this data that you've been gathering over the last few months. Tell us a little bit about that.
So we started, like I said before, really early on. We knew this was going to be our niche to really help individuals understand what's going on, and then also call, you know, elected officials on it to say, how can we make this better? So this dashboard started, I want to say, within the first couple months, working with CMS on data that we knew that was statewide to create dashboards based on vaccination rates, on death rates, on COVID cases with residents, but also COVID cases with employees and staff with there. And so we've been going through these past 2 years, and you can look at the whole picture on our website, which is aarp.org. I think it's like dashboard. If you just search dashboard, you'll find nursing home dashboard. You'll find it, but you'll see that, you know, it's much like how we face it. So when Omicron hit, it went back up in the nursing homes, but now we're back down and we're seeing lower resident cases, lower staff cases. The death rate has stayed the same at 0.4 over the last 2 months, so that's positive. So we're seeing some incremental changes that are a nice trajectory, but we're not there quite yet.
One of the things you discovered in compiling the data was the vaccination rates and the booster rates among both residents and staff? What did you find?
So the booster rates were much higher amongst staff, or residents, forgive me. We're having a hard time getting staff to get these boosters and also the vaccination. They're just not receiving it, and we're not forcing it, we're not mandating it. We do think that there is good science behind receiving your vaccine, and we really encourage individuals to look at that research and that data to make their own personal decision. But at the end of the day, you know, the ones that have gotten it, we see that there's not as much transfer of the COVID amongst those individuals.
And I was really surprised because I've been familiar with a couple of nursing homes in the community because I have family, but the number of employees not getting vaccinated at all, not even the first dose, was pretty high, I thought. I was surprising that direct care workers in nursing homes weren't getting vaccinated.
So they're not getting vaccinated at the rate that residents are getting vaccinated. We definitely see a lull in that. They're not accepting the vaccine. It's a little shocking, I think, from our perspective, just knowing that, you know, when you see the higher intake of individuals getting the vaccine that are residents and the curbing of COVID-19 as far as it infecting people, you would hope that they would get it. But again, it's a personal choice, and we're not going to force anybody to make that choice.
Well, there are some changes that are in place at nursing homes because of COVID that I anticipate will be permanent.
Yes, we are very hopeful. You know, along the same lines of staff, we have seen a major decrease in individuals wanting to do direct care, and that, you know, is for a whole array of reasons. And, you know, one of them could have been the stress of the job. It could be that, you know, it's not an easy job, and you have to really want to do this job in order to help seniors and older adults. So that's been a really major issue for many of the nursing homes. You know, but we're also seeing some great things with this American Rescue Plan funding that has been coming down. And we have been able to secure funding to do a pilot project for single occupancy nursing homes. And like we chatted before, there are nursing homes that have up to 4 people in one room. And that's, yes. And so that's not, you can't social distance with 4 people in your room. And so we're really hopeful that this is going to help out a little bit. And we're also looking at not even going into nursing homes. You know, not every individual needs to have that specific nursing home care. You can get a home aid individual to help you with your daily living with home and community-based services, whether it's getting a bath, going grocery shopping for you, cooking for you, cleaning your house, those types of things. And you can stay in your home as you age.
Also, you're advocating for something that's kind of a hybrid between staying in your home or a regular large nursing home. Something called greenhouse? Yeah,
so this is a new thing, and like I said before, we're really being innovative with how we're looking at long-term care. It's not nursing home or nothing. Home and community-based service, this hybrid called greenhouses, where you live in a smaller nursing home with 12, 15 residents, lower staff of taking care of you as well, but that really helps out with when you have these types of viruses that go through nursing homes.
And do you have any data on how well those residents fared with the pandemic?
Sure. Unfortunately, we don't have any specific data on them in particular. They didn't go through the state. They're more of a private entity, so they're not necessarily combined with nursing home data. But we can only assume that it was a better rate of lower rates and better health.
Last time we were hearing some horror stories about some other states, and I think Governor Cuomo, then Governor Cuomo in New York, had been accused of falsifying or hiding data from nursing homes to make it look good. But we found out that that wasn't the only state that was happening. How does Michigan compare with some other states?
You know, there have been a couple audits. We're still kind of going through that data, trying to figure it out. You know, Michigan ranks pretty high. We're not definitely the highest states in doing the best that we can do. But like I said, we are still trying to implement a lot of these best practices so we can really stop the spread of COVID in these nursing homes.
So this dashboard, do you anticipate keeping it going even as we hopefully wind down from the pandemic?
Hopefully wind down, yes. I think we will. I haven't really heard from our national office what our goals are, but it has been so successful. I've been doing these conversations throughout the state. Everybody wants this information. Whether you're going to go to a nursing home or you have a loved one in the nursing home, this is so important for your safety and your protection. So I really hope we do keep them going.
What are the next challenges that nursing homes face? You mentioned staffing, obviously, that's everyone.
Yeah, so staffing is one of the biggest issues that we're facing right now. The adequate staffing, what retains an employee? Is it more money? You know, is it the stress of the job? Is it having more people to bounce ideas off of and help you out in situations? Is it professionalizing, you know, the direct workforce? So we're still working with that with the department and as well as the nursing homes to find out what this looks like, what we can do better. And again, you know, really looking at it's not just the way it has to be. How do we be innovative? How do we get more greenhouses in Michigan? How do we have more single occupancy rooms? You know, how do we implement more home and community-based services for individuals? So all of these things really play in, and it's not just a one answer. It's going to be everything and everyone kind of coming together to figure out what this looks like.
Well, the good news, Melissa, in Jackson County, all of our nursing home facilities and operators got good marks in taking care of the residents despite the challenges. And so many of them got very innovative and created new ways to keep the residents engaged and safe and happy, and their families as well. So I think there was a lot of above and beyond in the nursing home industry in Jackson during this pandemic.
That is so great to hear, and that would be a great best practice to share across our great state of Michigan, to say this is what we did, this worked for us. And I'm sure that you have unique nursing homes and one that looks like other nursing homes, so it would be nice if we could share those ideas and really use those across the state.
Well, we appreciate the work that you and AARP Michigan do and continue to do, and thanks for coming down today.
Thanks for having us. We appreciate it.
Nice to see you.
Nice to see you too.
Melissa Seifert is the Associate State Director of Advocacy for AARP Michigan. Hope you can stay with us. We've got a lot more on today's show. Angelita Gunn joins us from